So, hello all. Thank you so much for coming tonight. It's really great to see so many people have arrived. So I'd like to welcome you to this event brought to you by the IET. So we are the Biomedical Engineering Group. My name is Jack Hayes. I'm a PhD researcher at Imperial College London. My work is looking into prosthetic skin. So I'll be hosting and chairing this event and webinar tonight, and I have my colleagues in attendance, so they'll help me with the running and the scheduling of the event. So I'd like to talk you through some of the aims of the group. So the aim of the group is to raise awareness and further knowledge in a multidisciplinary field, because we feel that is one of the core aspects of biomedical engineering. So we like to host these events and get people from different areas, clinicians, engineers, biologists, and bring them all together in one place and listen to talks from industry and get people discussing and involved together. So we'd like to support the industry as a whole to advance through networking opportunities, and we'd like to do that through these events. And we'd like to then be able to have an environment where we can connect together afterwards, and we can allow people to speak up and showcase the research, just as Ben's going to do for you today. So, as a group, we're always looking for more people to help join and help us with the running of these events. We're a recent group. We've formed in 2021, and there's about 6 of us so far. So we'd like to put that out there for anyone that would like to join and help push the industry and help the activities of the group. It's great for meeting people and talking through with other individuals. It's great for supporting your CEng registration. A attendee and committee member on the call today, Ashkan, has been able to achieve that through the IET. And it's obviously a valuable addition to your CV, being able to engage with industry like this. So if you have any desires or wishes to help in whatever way you can, please send an email to Ashkan with that email address below, or myself, and we'll be able to keep those contact details in the Q&A box later on if you're interested in that. So today's event is how wearable technology is being used to improve the lives of prosthetic and orthotic users, or P&O. Your speaker is Mr. Benjamin Griffiths from the University of Salford. So a little bit about Ben. He was awarded a BEng in Mechanical Engineering from the University of South Wales. He then undertook a MSc in Sports Engineering at the Sheffield Hallam University. Ben has held the role of Research Associate at the University of Salford and is currently undertaking that role. Ben's research interests are monitoring the physical behaviours of P&O groups with the aim of bringing data science methods to develop physical behaviour models and validate health research products. So I'd like to just run you through this. The webinar will be running till about 6:30. The talk itself will be between 30 and 35 minutes. And we'll then take a round of questions. If you could please use the Q&A box to direct those questions, and then Ben can engage with them later on. And then in terms of general housekeeping, I'd like to let you know that the webinar is being recorded. So if you know anyone that couldn't attend today, please direct them to the YouTube account, which will be linked later on. If you desire to progress towards CEng qualifications, this event contributes towards CPD, so please contact one of the 3 individuals listed below to be able to get your CPD certificate. If I could please ask that everyone in attendance turn off their mics and their videos, as this can be quite distracting to the speaker. So if I could then ask Ben to share his screen and get his talk underway.
Yeah, sure thing. There we go. So thanks very much, Jack. Thanks for the kind introduction, and thanks for inviting me along to present. And thanks to everyone at home that's joined to hear me speak about my work on this lovely sunny evening. It's my pleasure to take you through my presentation on how wearable technology is improving the lives of prosthetic and orthotic users. As Jack said, I'm a researcher at the University of Salford. And over the course of this presentation, I'm going to be talking you through some of my own work, the work of some of my colleagues, and some wider initiatives from the university that enable us to better work with industry. As Jack said, if there is anything you would like to clarify with me, or you think of any questions during the course of the presentation, then please feel free to put them in the Q&A section. And yeah, I'll be happy to answer those at the end of the talk. So to get things kicked off, I've got a bit of a confession. The title of this presentation has a bit of a mistake in it. And this is my fault because I came up with the title of the presentation a few months back now, when I initially thought up some of the ideas on what I was going to present. The title of this talk should say, how wearable technology could improve the lives of prosthetic and orthotic users. Because really, everything I talk about tonight is focused on research and recent projects that myself and other members of the university have been working on. And the obvious theme you'll notice about the work is that we're not doing enough of it. And in order to make a real difference, we need to keep going and doing more. So this might sound a little bit cryptic right now, but I thought I'd drop that in here at the start to make sure I keep all the pedantic people like myself happy. But before I get into the presentation, I thought I'd give you a bit of background information on myself, although I think Jack covered some of this in his introduction. So as Jack said, my background's in engineering. I studied at the University of Glamorgan, which is now University of South Wales, for my BEng in mechanical engineering. And then I went on to work in the automotive industry and building services industry before I decided to go back to Sheffield Hallam University and study for my MSc in sports engineering. I had grand ambitions of becoming an engineer for British cycling, designing bikes to win the Olympics. But unfortunately, jobs for British cycling are few and far between. But I was lucky in that this master's degree led me on to work on a knowledge transfer partnership, where I started working with the University of Salford and an external startup company. And during this time, my job became designing algorithms and trying to predict people's physiological states, such as how much energy they're burning while they're exercising. And a lot of this work involved collecting, processing, and analyzing data before then using this to design the algorithms. Since then, I've gone on to learn that this is what people call data science. So these days, I'm working for the University of Salford on similar health sciences research. And I like to think that I'm able to combine my mechanical engineering knowledge with my sports science knowledge and newly found data science skills to work on impactful research projects. But anyway, that's enough about me. Let me talk about some of my colleagues. So I'm part of the Salford Human Movement and Rehabilitation Research Group. And we're a team of engineers, health professionals, psychologists, and social scientists focused on rehabilitation, movement sciences, and associated clinical applications. Our research is aimed at addressing several important global health and social care trends that limit people's mobility and their ability to live independently. So much of the work I'll present this evening is aimed at tackling these challenges. Within the university, we also run the relatively new, I think it's been going for a few years now, Centre for Doctoral Training in Prosthetics and Orthotics. So this centre combines expertise from University of Salford, but also Imperial College London, the University of Strathclyde, the University of Southampton, and global industry partners, with the aim of creating a new generation of highly skilled researchers who are able to better deliver both technology and services to meet the needs of prosthetic and orthotic users. So today I'm going to be talking about research which has come out of both the research group, but also new research which is being done by members of the CDT. So let me explain the main challenge that the research I'm going to present today is trying to tackle. So currently, WHO estimates that globally around 100 million people require access to P&O services. If you combine this with several factors such as aging population, the rising incidence of vascular disease, an increasing number of road traffic accidents and traumatic injuries, and this number is only going to climb higher and higher. So the demand for prosthetic and orthotic services is going up, and we need to find a way to meet this demand. Now, currently, we already have the ability to create great and interesting prosthetic and orthotic devices. And you can see there on the screen that we have a range of different products that some people can access. And you'll have seen some of these amazing products on show at the recent Paralympic Games. We're also starting to develop frugally designed devices to meet the vastly increasing demand in middle and low income countries, where there are unique challenges that come with these environments, such as climate, the accessibility of devices, and the ability to service and maintain these products. And I'm going to talk a little bit more about this later as it relates to some of the work I've been doing myself. So the problem we have is this: we currently don't have a very good idea on how people are using their current devices in their everyday lives. The design and development of these products is based on the idea that people are going to use them and use them in their intended manner, so that they fit within their normal life and improve their functional ability. But most of the development is based on lab experiments to understand how these devices could be used. And actually, very little is done to monitor their usage after they've left the clinic. So this review by Chadwell et al. From our research group sought to understand the technology used to monitor prosthesis use and how it's actually implemented. And they found that there is currently only limited objective data on how much and when prosthetic devices are worn, what tasks they are used for, and any adjustments that can be made through monitoring that could improve their usefulness for each individual. And although recently the amount of publications in this area is increasing, it is still not commonplace that objective monitoring is used in clinical practice when someone receives a prosthetic or orthotic product. There are a few reasons for this. Some are obvious, such as the cost and access to the technology and knowledge of the methods of how to perform this kind of analysis. And I'll talk about a few others at the end of this presentation. But also you can see that there are much fewer publications in upper limb prosthetic monitoring compared to lower limb monitoring. So in this population, there is still a demand for this research, and we need to be pushing this forward. So why is this important? Well, there are a few obvious points. By better understanding how a person is using a device, we can take a user-centered design approach where the device can be adjusted to suit the user's needs and hopefully then go on to improve their functional outcomes. However, what is more important is that we understand how amputees are using the device and understanding what might suit them best. That way we can better allocate resources for the future. And we can also better forecast future use and demand for these kind of services. But right now, we're not currently shooting in the dark. The traditional way of monitoring how people use their device is simply to ask the patient. Self-reported surveys have been used for quite a while and are commonplace in research when developing products. To understand how a patient uses their device, we can simply ask them the question, on average, how many days did you wear your prosthesis? And this provides us with lots of rich information on their thoughts and opinions on the device, and also how they've been using it. However, there are a few issues with this method when it comes to performing a deeper analysis of their device use. Feedback in this way is often subjective and can be influenced by other variables outside the research team's control. If you ask someone to recall how often they use their device over the last few weeks, they might not be able to recall their usage correctly across the whole time period, just because it's difficult to remember that kind of information. Also, there could be some reason they might want to present more favorable information to the research team if they think they're going to get something out of it, or even the opposite. So although it's important that the user's opinions are taken on board, it's often necessary to complement this with objective methods for monitoring their device. So in order to do this, we turn to technology. There is already a large body of literature on wearable technology and activity monitoring, but very little has been done when it comes to monitoring the activity of prosthesis users. We can see that we already have a huge range of devices that are capable of monitoring activities. Most of these stem from research on health and exercise, and some have become more commonplace as commercial products. But we don't currently have many, if any, monitors specifically designed for amputees, although I know some prosthesis manufacturers are starting to integrate these into their products. So if we're going to monitor patients while they're using the device, what kind of things do we want to measure? Well, it's probably worth trying to measure their activity, as this would enable us to see the impact of a device on their everyday lives and their activity throughout the day. The limited amount of activity monitoring research in amputees populations have already looked at assessing step counts as a primary measure of lower limb prosthesis user activity. However, it's clear that someone's activity, or what is known as physical behavior, which is how it's referred to in research and includes subcategories of activity such as inactivity and sleep, etc. It's clear that that is made up of far more than just your step counts. Some things that are typically measured using activity monitors include things like standing, how much standing time you have in a day, stepping, so how many steps you accrue, sedentary time, so how much time you spend sitting or how much time you spend in sedentary postures, so cycling or recreational activities, how much recreational activity you perform, sleeping, transport, and one specific important feature of physical behavior monitoring activity in P&O users is how they use the device, what time of day they're using it, how often they're using it, how long they're using it for. So these are all important measures that need to be taken into account to fully understand someone's physical behavior. And if we can capture this information in an amputee population, we might be able to better understand their ability to take part in activities and how it changes with and without their prosthetic products. So this brings me nicely into some of the research I've recently been working on, where I've been developing a method for monitoring lower limb amputees' physical behaviors using a prosthesis integrated accelerometer. So just to give you a quick bit of background information on this project, the work is part of the Take Up project, which is an EPSRC funded project in collaboration with Exceed Worldwide in Cambodia, the DPO at the National Institute of Social Affairs, the University of Salford, so us, and Imperial College London. And the main objective of the whole project is to evaluate the use of a new low-cost knee joint design within developing countries. The reason for this project is the vast amount of research and development on both the design and evaluation of prosthetic devices is concentrated to Europe and North America, and therefore often devices are inappropriate for use in developing countries. So the P&O research group at Imperial have come up with this new knee design with a focus specifically for the application in developing countries. And the experiment as part of this project is being conducted in Cambodia. So in the situation it's being developed for. So as I've said, we typically monitor physical behaviors using an activity monitor. And the example we use a lot at the University of Salford is the ActivePal device. So this is a device that contains an accelerometer, which is mounted on the thigh of the user. There are other mounting positions, but the thigh is a typical position used in physical behavior monitoring research. So the way the device works is by using its reference to gravitational acceleration to classify postures such as sitting and standing based on the thigh orientation, and then looks at other acceleration features like signal frequency to classify activities like stepping. It does this throughout a measurement period until eventually we build a picture of the wearer's physical behaviors, which gives us a rich data set to analyze. And we can hopefully then see patterns that emerge from different activities at different times of the day. So we could use this device to monitor the amputee's physical behaviors. However, the limitation is that for below-knee amputees, mounting an activity monitor on the participant's thigh means we might not be able to also collect non-wear data because the device has no interface with the prosthesis and therefore no way of knowing it's been removed. Obviously, this is dependent on the type of amputation and the type of prosthesis being used, but we wanted to develop a method that was applicable to all lower limb amputees. Also, because the method used to mount the activity monitor on the thigh, which involves this sort of sticky covering plaster, it can quite often come loose, fall off, and in general, some people are just opposed to the idea of being monitored. So there could be issues with, could be social issues with having an obvious monitor attached to their leg. So instead, we thought we should try mounting an accelerometer onto the prosthesis itself. And then we can monitor both the physical behaviors of the amputees while they're wearing the prosthesis and the non-wear time, with the added benefit of having no impact on the wearer's comfort. One other bonus is that mounting the device on the prosthesis gives us the opportunity to develop a robust waterproof casing that would protect the device from the environment and make it less visible. However, now we can't rely on the activity monitor's native algorithm that I described previously for detecting events because it's going to misclassify sitting events as standing based on the orientation of the device. So we needed to develop a new method for classifying events from a Shank accelerometer. And this has been where most of my time has been spent on the project. So I won't go into the full methodology I used to develop the algorithm. We are literally days away from submitting the publication for review. So hopefully it will be out soon and those interested can have a look at what I did. To quickly summarize, I developed a method to collect free living labeled activity data. And then along with this, I developed several machine learning classification models using the raw acceleration data. Then I looked at a set, I used this to perform classification of 4 different posture classes that we investigate, which were lying down, sitting, standing, and stepping. And we assumed that these were the main postures that make up an individual's daily physical behavior. So a quick description of the outcome of the paper. We were able to build a random forest classification model that was able to accurately classify 4 postures with greater than 90% accuracy, which we deemed to be suitable for assessing these physical behaviors. So what's next? Now that this method has been developed, we're about to start collecting data in Cambodia, where participants are trialing the new prosthetic knee design. We're hoping to collect data that would enable us to validate our classification algorithm on this specific population, and also use it to understand how the prosthesis users' physical behavior changes with the introduction of their new device, so then assess their activity while using the new device. So this has been my research on developing a method for monitoring prosthesis users, and hopefully it's clear that how this wearable technology, this monitoring system, can be used to improve the lives of prosthesis users. I'm now going to go on to talk a bit about some of the work my colleagues have been doing at the university and some future work that's going to take place over the next 12 to 24 months. So this work was conducted by my colleague, Dr. Alex Chadwell, who completed her PhD at Salford. And her work is a little bit further along than mine because she was using a physical behavior monitoring method that she'd already developed in order to monitor how upper limb prosthesis users actually use their device. So I've just described the development method I've worked on. This is an example of how it's being applied and actually used now. And specifically, she was comparing what a device was designed to do and what a person is able to do with it when tested in a lab, compared to what does the person actually do with it when they take it home and use it in their own environment. So she designed a method whereby she could use a range of different activity monitors, and essentially she was looking at symmetry between the way individuals use their anatomically intact limb and their upper limb prosthesis. The idea being that she could look at the usage of each limb and would be able to better understand how and if an amputee was using their prosthesis. She also developed a unique method for looking at this data from devices mounted on both wrists. So there was an activity monitor in both wrists, and this is how she looked at the balance between each wrist. So I'm just going to talk you through this method so the next slide makes sense. So imagine a 24-hour clock, and at midnight at the top, you have midnight at the top and midday at the bottom. And if data recording begins at a specific time on the first day, we can build up the data day by day in the form of a spiral where each ring represents another day. And then we can start to see some patterns emerging from the data. So the orange sections represent when both arms were at rest. So we can clearly identify times when the person was asleep or remove the monitors if they were going in the bath or something like that. What is more interesting, however, is this large blue section showing the activity during the day. This is actually made up of a gradient of color all the way from green, down to green, which represented unilateral activity on the non-dominant side or the side of the prosthesis, all the way down to magenta, where all the activity is focused on the dominant side or the side of the anatomically intact limb. What I want you to take from this plot, however, is that this data is on a healthy anatomically intact example, and the data is primarily blue, so there's equal contributions from both arms. But also there's sporadic portions of both green and magenta mixed into the data, showing that both arms individually contribute to everyday activities. Sometimes they're used in isolation, but they both contribute to the activities. So here are some of the results from her work looking at the data collected in everyday living situations, so not in a lab. On the left, we have an anatomically intact individual, and on the right, we have a prosthesis user. And if we look at the daytime periods where the prosthesis user was actually wearing their device, you can see that the clear color difference showing the preference towards the anatomically intact arm. You can see the magenta there showing that they're using their anatomically intact arm more than they're using their prosthesis. So this means that the user isn't really using their prosthesis that much. So with this, Alex developed methods for assessing both bilateral and unilateral arm use in functional lab-based tasks. And this is an example where the participant has to stack and unstack cups in a certain time period. And I actually had to go at this task, and it's pretty challenging. So Alex's research found that users were biased towards their intact arm, and it appears unrelated to their specific task performance. So they were biased towards their intact arm regardless of how well they performed on the task. All of this research has already been published by Alex, and you can find information on that if you follow this the title of the work here. I'm sure you'll be able to see this on the recording of the presentation. But the main findings of this research was that there were no significant correlations between any of the measures of functionality and everyday prosthesis use. So just because a person is able to use their prosthetic hand doesn't necessarily mean they choose to use it day to day. Plus, just because a person is wearing the hand doesn't necessarily mean they use it in a functional manner all the time. She also investigated the duration a user wore the device and how this influenced how they used it, and also found no significant correlation. So a person with a smaller amount of wear time may be putting it on when they want to use it and actually show more reliance on it during the periods of wear, as opposed to someone that wears it all day but doesn't actually use it for many tasks at all. So this has really interesting implications when it comes to how we allocate devices to individuals, and shows that we need to take a much more tailored approach, an individual level approach. Also, that we need to use methods like this and not just general decisions on functionality and device for device allocation. One thing we do need to keep in mind is that Alex's study, which was only done on 20 participants, was one of the largest experimental studies internationally, but was still too small to draw in-depth conclusions from to support policy. So we definitely need to do more work in this area. Now, I just want to talk briefly about some of the planned research that will be happening over the course of the next 12 to 24 months at Salford. And as an introduction, in my introduction at the start of this presentation, I described that this work is going to be coming out of the CDT and our students as they finish their master's year and go on to working on their PhD projects. So one of the existing issues I haven't addressed yet is having suitable outcome measures for assessing both upper limb and lower limb prosthesis usage. Previously, I've described how basic physical behavior monitoring can be used to look at how activity changes with respect to different devices. And following this, we talked about Alex's methods for assessing upper limb usage with respect to anatomically intact limbs. But a major issue, and this is because the field of research is still developing, is that we don't really have real-world objective outcome measures to fully assess device usage. What we really need to do is realize the features that are most relevant for clinicians. But we do have a few projects underway that can help bridge this gap and capture this information. For instance, one of our CD2 students, Michael Prince, is currently working towards his PhD, where the aim is to create an objective assessment method to improve the consistency of K-level classification in lower limb amputees. So K-level classification is a way of quantifying the need and the benefit of prosthetic devices for patients. So by better assessing this need and developing more suitable outcome measures, we'll be able to better assign devices to prosthesis users. Most importantly, he's planning on using an objective method which assesses the patients in a normal environment, which, as we've already discussed in this presentation, is very important. So we also have another CDT student, Victoria Patrick's, looking to design a web-based platform that will enable telemonitoring of prosthesis users, providing clinicians with almost real-time data on how an amputee is getting on with their prosthesis when they leave the clinic. Part of this project, or a big part of this project, will involve identifying clinically relevant features from activity monitoring data and designing a platform that can provide this data to a clinician in an effective way. So this is the new research coming out of our research group and the CDT program, and it aims to fill these knowledge gaps and help contribute to improving the lives of prosthesis users. Finally, I want to talk very quickly about initiatives at the university that are enabling this research to be fed out to the wider community and further impact the lives of prosthetic and orthotic users. So the university has a major focus on ICZs, which is they've dubbed industry collaboration zones. And these are essentially collaborative projects set up from different departments within the university and external commercial organizations to facilitate the transfer of skills, both internally and externally. So following on from this idea, the CDT has united industry and clinical partners to ensure that the outcomes of the work of the CDT actually impacts on prosthetic and orthotic services. So this includes two of the largest manufacturers of prosthetic and orthotic devices, Blatchford's and Osser, ensuring that the research from the CDT is embedded within the main suppliers of prosthetic and orthotic devices. The university also have links with other industry through programs known as knowledge transfer partnerships. And these partnerships enable the transfer of knowledge from within the university to external organizations. And it's how I began working with the university. Although these partnerships can be with large organizations, this initiative also enables smaller startup companies to enhance their services and products through knowledge exchange. And Manchester, on the doorstep of Salford, has a thriving startup community, and there are many interesting companies partnering with the university at the moment. The reason I bring this up is because in the past, the university has partnered with pretty interesting wearable technology startups, including a company that developed smart textile systems with the aim of creating unobtrusive monitoring devices. The system used conductive textiles to pick up electrical signals from the body, like heart rate and EMG signal measurements. And systems like this have the potential to feed into our P&O research by creating more adaptable and useful monitoring products. Specifically, this kind of system could be used for something like developing a myoelectric prosthesis through their EMG measurements. But these are just a few ways that our research is getting out into the wider community. So the take-home message of this presentation is this. We have the ability to create useful and effective P&O products. However, we don't really have a satisfactory level of knowledge of how people are using these devices. There is research being done to develop systems to monitor P&O usage in normal everyday situations. Also, research is starting to emerge on what users can achieve with these devices and ultimately how they use them and how they impact their lives. However, for this to become common clinical practice, we need to understand the important outcome measures we can use to understand usage and develop systems that feed this information to clinicians so that ultimately they make better decisions and better and more informed decisions. So I just want to quickly say thank you to everyone that helped me with this presentation, especially those that let me present some of their own work, and I hope I did it justice. Thank you to everyone for listening. I think we're going to go through some of the questions now. If you have any, if you do want to get in contact with me outside of this session, however, if you don't get around to your question, then my email address is there on the screen. And also, if anyone is interested hearing about some of the other interesting projects going on in the research group, because this is certainly just a drop in the ocean compared to all the other projects and applications, then the Twitter handle for the research group is there. We also have a YouTube channel with some of our internal presentations as well. So thanks again, and I'm happy to answer any questions.
Wow, thank you so much, Ben, for presenting all that wonderful work. And it's really great to see how engineering can be applied to healthcare settings and how multidisciplinary the approaches and solutions become. So that's really great. I've got a question for you. I was just earlier in the presentation, you mentioned about some of the challenges in lower middle income countries. I was wondering if you could expand and explain how they're different to challenges we might see here in the UK.
Yeah, of course. So we sort of covered a few. Obviously, a lot of these countries have different environments. So typically, where they're predominantly going to be used is quite different from Western countries like North America and Europe. They're typically more rural and things like that. But also the kind of devices developed are very practical for uses in Europe and North America. However, they don't bear so well in lower income countries. We did a data collection down in Imperial with an ex-serviceman, and he was constantly saying that his new device that he was given was useless out when he was out in Africa and places like that. And a lot of it comes down to the the availability of ways to maintain these products, because they're mechanical systems, so they don't last forever. And quite a lot of the time, he was saying that that you need more products that are designed more simply and easy to fix and repair. So yeah, those are just some of the yeah.
Fantastic, thank you so much, Ben. We've got loads of great questions here in the chat. There's two from Hazel, so I'm going to roll them together. So Hazel would like to know what were the correlations in Alex's study between usage of the prosthetic and how long the individual had an amputation and had the prosthetic for in their lifetime. And she'd also like to know about the links to personnel in the armed forces for your studies.
Yeah, of course. So I'll take the second question first. So links to armed services. So actually, going back to that data collection I performed in London, that was sort of a trial for my research. Actually, quite a lot of the participants we had coming in were armed personnel. And I think it was just the nature of recruitment and how easy it is to get access to those kind of people, and how willing they are to participate in these kind of studies. So we do have links. We don't have that's kind of the only link we have. We have no other existing links I'm aware of. And could you just ask me that first question again?
Yeah, of course. So Hazel asks, what was the correlation in Alex's study between usage of prosthetic and how long the individual actually had the prosthetic? I think that means in terms of how long they've had an amputation for.
Yeah, of course. So, I mean, I'm not entirely familiar with all of Alex's work. I think there was a sort of a medium amount of correlation between how long they had the device and then how often they used it, but this correlation wasn't significant.
Yeah. Okay. Fantastic. Got one here from Shruti Turner. She says, "Great talk, thank you." She says, "How do you and this wider team anticipate using the acceleration data and your classification algorithm to have a practical impact on the lives of people with amputations?"
Yeah, thanks. So that's a very good question, actually. So we've developed this classification algorithm, or we actually developed a series of different classification algorithms, but I'm only going to talk about the best performing one. So I assume that's the one that most people on. So we developed this system with the idea that it would be open source. So everything is written in Python, including the data processing methods, and obviously the methods for the data collection and how we actually created the algorithm will all be available in the research paper. So the idea is that, well, all of the code for the project is on GitHub, and so are the actual developed models. So the idea is that people can hopefully follow the instructions on there, go up there, collect their own acceleration data, and ultimately use that to run their own studies or classify people's postures. In terms of implementing it into products, we don't have any idea about how we're going to do that. It's all very early stage at the moment, but yeah, the idea is it's open access and anyone can use it.
Great, thanks. I've got a question here from Alex, and he would like to know the difference between functionality in the kind of more modern European OSSA prosthetics and the ones you'd see in low and middle income countries. And just to add on to that, a few people would just like to know kind of a rough estimate in price difference between the two.
So he's talking about the functionality of the device itself, so how it works. So the idea was that this idea kind of came from the fact that the current existing frugally designed lower limb prosthesis for middle and lower income countries, it wasn't meeting the standards that were required. And to be frank, some of the research team are amputees, and they were saying that, you know, it kind of came from the idea that, oh, we could do a better job of this. So so yeah, the functionality is that you've got the it's an articulating knee. It has lockout functions. I'm not entirely familiar with the whole design, so I couldn't go into a great amount of depth. But it's able to meet the demands of lower middle income amputees. What was the other question? Sorry.
And then just a kind of estimate on the price difference between something you'd see in Cambodia versus something you'd see in the States or in the UK. So I don't actually have an idea of the cost, but I think you could, you know, you could estimate that it's going to be quite a lot of money. Like some of the modern day prostheses, and they are very, very expensive compared to this. So yeah, you're quite a lot of money, but I'm not sure exactly. I know the MIT micro processor knee can kind of start at about $50,000. Whereas the ones you kind of see in Cambodia are usually donated from kind of 1970s design, aren't they? So yeah, there's definitely a big difference in the technology and the access to the technology.
Yeah, you're looking at, like, you know, 90 to 99% differences in prices. It's crazy. So yeah, very different.
Just a question from Matt, and he would like to know, have you considered combining active and passive monitoring to improve understanding of how patients are using their devices? For example, he says, if the patient removes their prosthetic, you could then ask them why they had done so, perhaps through an app. So
yeah, I mean, that's part of the idea of what we're doing when we're doing this data collection in Cambodia. It's gonna, the objective monitoring method we're gonna use will be complemented by a subjective monitoring method. So we're going to use a questionnaire or a focus group to get their feedback on these kind of things, because you know, their opinions on the products and why they did certain things is also very relevant. We've not thought of developing, as you said, like an active system where they could be notified by an app. I think, you know, that's a great idea, and you know, it's something that someone in the future might do as part of a research project. We don't have any plans at the moment, but no, it's a great thing to think about.
Fantastic, thank you so much, Ben. And then my final question is, what are the hopes for what your methods will be able to achieve, and how would that improve, firstly, life for the P&O user, and secondly, how would that impact kind of like a healthcare system, do you think?
Yeah, I mean, ultimately, we want this method to go on to help, or, you know, all of this research, we want it to go on to help better characterize the way amputees are using their devices. And hopefully this will, you know, we can better allocate services, therefore reducing costs and improving the services we provide. And sorry, what was the last bit of your question?
And just how that would impact kind of a healthcare system.
Yeah, and again, it all comes back to saving costs and improving the services provided from you know, national systems like the NHS and yeah.
Okay, fantastic. Thank you so much, Ben. I'll just take the screen sharing for a second, if that's okay. Okay, so yeah, I'd just like to kind of bring the session to a close, and thank you everyone so much for your questions. It's great to have these kind of talks and then see everyone asking questions and really trying to dig out more from Ben, because he's very knowledgeable, so it's good that we've got him here today. So please contact him if you have any more questions for him over the next coming days or so. I'm sure he'd be more than happy to answer you. So I'll just finish up with just asking again, anyone to help grow the IT as a group. It's fantastic you're here, and you know, come to future events. We hope to keep giving you talks and areas that you'd be interested in. And it doesn't have to be biomedical engineering. You know, feel free to join a group that's not related to that within the IET. You know, and we'd love to involve companies. You know, Ben discussed there the importance of the startups and his journey to where he is now and how that impacted him. So it's great to hear how those people view things and how they think the industry is going to go forward as a whole. So please, if you are involved in a company or know of a company that would be interested, please come and talk and attend the event. You know, it's always great to get researchers talking to members of industry. In terms of the CPD, if you're interested in having a certificate for your attendance today, please email one of the people down below. I can put my email in the chat as well. That'd be fantastic. I'll also put a link, or one of my colleagues can put a link in the chat to a survey that we're trying to understand kind of our demographics so we can better tailor kind of events for you. So if you could fill that out, that would be really, really great. And in the future, we plan to have these events as hybrid. So it'd be really great to see actually some of you people in person. That would be great. And we can hope we can carry on keeping doing events like this. So if you don't mind, Ben, I'd love to hear what your kind of closing remarks are to the event.
Yeah, of course. So hopefully this has shown everyone the potential for wearable technology to, or monitoring systems, depending on how you want to refer to them, for improving the lives of prosthetic and orthotic users. We need to encourage more research into this subject to help it become commonplace and hopefully eventually make it become common clinical practice. So I hope this was useful, and thanks everyone for joining. It was great fun, so cheers. Yeah,
thank you so much, Ben. So with that, I'd like to conclude the talk today. I'd like to thank everyone so much for coming. Really appreciate you giving us a talk today, Ben, and being able to share some of the work that you've done from Salford. So a big thanks to the researchers as well that have let you present their work. It's really, really kind. Definitely a very interesting talk, so we're very grateful for that. And I'd like to thank all the people that helped organise this event that are here today. And yeah, we hope to see you in the future. So please think about joining and filling in the survey. Thank you so much, and thanks for attending.